The CBO does predict that by the year 2026, premiums under this GOP plan would be about 10% lower than they would have been under Obamacare, though the same does not hold true for older Americans who would likely see their premiums go up. Conservatives, Elaine, may like the fact that this plan is significantly cheaper than Obamacare, largely because of those big cuts to Medicaid.
So on the cost of the plan, Nancy, according to the CBO, this legislation would reduce the federal deficit by $337 billion over 10 years, as you cited there, in part due to the cuts to Medicaid. Now, universal coverage, we know, is not Republicans' goal. The goal, as we've heard from Republicans, is more freedom and choices. Does reduction of the deficit and increase of choice outweigh the reduction in coverage for some conservatives?
Some Republicans will say yes, that their goal is lower cost. Their goal is to remove some of the burdens that they feel that Obamacare placed on both customers and the insurance market. But a lot of Republicans are going to say, look, a 10% cut in premiums compared to Obamacare is not worth a level of people in this country uninsured that is higher than before Obamacare was put into place. That is going to be a challenge not just for Republican lawmakers, but also for the public, their constituents. And so I think the survival of this bill, Elaine, is really going to depend on Republican leaders being able to convince their own rank and file that this plan is just step one, and that in steps 2 and 3 of their reform plan, they will be able to put measures into place that will enable people to get coverage at higher levels than this CBO report indicates.
Well, Nancy, you touched on it there, but what has been the broader reaction from Republicans as well as Democrats who think that essentially the rug might be being pulled out from under millions of Americans if, in fact, this bill is passed?
Right. I mean, we just spoke to Lindsey Graham of South Carolina a short time ago, Republican, who said, look, even if the CBO is half right when it comes to these numbers, that's still very troubling. And Republicans should work harder to come up with a plan that doesn't lead to a CBO score like that. A lot of Republicans believe that the CBO isn't infallible, can make mistakes, and this is a very difficult thing to try to analyze exactly how many people will drop insurance coverage, for example, once there's no longer a mandate requiring them to have insurance. So it's not an exact science, but you have Lindsey Graham already and John McCain and others saying these numbers are a sign that the GOP needs to slow down, needs to make some changes to this bill before they vote on it.
All right. Nancy Cortez on Capitol Hill for us. Nancy, thanks so much.
You're welcome.